Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractic and Posture Clinic. Let's find out how to assess yourself for movement and see where to even begin. So this video is highly important for self-assessment of your functionality, so stay tuned. So when a patient comes into my practice, one of the main things that I do in my initial examination is to see how functional or dysfunctional the movements are. You see, you can have chronic issues, musculoskeletally speaking, or you can repeatedly injure yourself, or for some reason you just hit that dead end where you're performing your favorite sport, you're pretty good at it, but you're just not going beyond a certain level. So it's almost like you're maxed out on your potentiality, which is not the case. So in order to find out how functional you are, because you see, if this body is a machine, you want to see, is it compatible with the way it was designed to be? So what is the design of your body's movement? It's very easy to conclude that since all babies on this planet, regardless of our differences, move the same way and reach a certain developmental stages, with a few exceptions of genetic or malfunctions at birth, then that must be how we are designed to move. That's the blueprint of movement. So if we take the time to understand those movement principles, and then apply those principles in assessing how patients, in my example, move, then I can see how close they are to the design or how far away from the design they are. One of the first things I'm going to invite you to do is just sit just like I am. So the way you're going to sit is like this as an example, where you're sitting upright. So if your hip is tilted up, that means your hip joint is dysfunctional, because it needs to be really, you should be able to open that hip joint. And with practice it comes, believe me, I know, because I didn't used to be able to sit like this, and it's still, ideally, this knee needs to be down here and this down here. With effort I can do it, with repetition I definitely can. So you're gonna sit like that, and the arch of your foot's gonna sit right against your knee, and then your other leg goes that way. So the first thing we want to do is we want to helicopter up. Helicopter up means when you want to get up, you're not going to use your hand and do this. You're not going to go that way. I led with my hand and I maneuvered my body to gain strength in the body parts, where in reality, in this position, my torso, if this was a rectangle, my torso is my stabilizing body part. So everything that has to do with this rectangle needs to support the rectangle while my lower extremity goes through the movement and the challenge. Like I've said before in some of my videos, if movement is a concert, this is where everyone's playing, but now in this specific pose and movement series, the spotlight is on the lower extremity. So I'm looking to see, do the stabilizers stabilize the body while the extremity does the performance? So in order to get up, what I need to do is use my butt and my legs to simply helicopter up, and then slowly go down. So I'm going to show you the sideline. I don't want to be doing this to get me up. I got up, but dysfunctionally. What I want to do is I want to engage. There's certain rules that exist. I'm going to skip here, and what I want to do is up, down, up, down. My rectangle keeps the stabilization of the rectangle. This is the rectangle I'm referring to. I'm not leading the movement with my neck or my shoulders or anything else. So once I'm up here, then I want to be able to stabilize my rectangle as I swing. I shift this way, bring that up, and then I'm gonna get up like that. I'm gonna move back just so you can see what I did. So once again, once I'm up here, I don't want to go this way and get myself up. Sideline would be that. My stabilizer has to stabilize as I go up. So then, once you're up, you're gonna go around. I need to stabilize this area as I swing around, go down, up, and go through that procedure. If you can't even get yourself up, that's a dead giveaway, that is dysfunctional. If you get yourself up, leading with your neck, that means your neck leads a lot of movements that are not neck related. That relates to the tension in the neck, to your history of headaches, to feeling tense up in this area between the shoulder blades. If your glutes and your legs can't lift you up, which is their job, then in every step you take, they're lacking performance. That means they're related to some of your lower back dysfunction and pain. Do you isolate and work it out? The answer is absolutely not. There's another video I've done on this very principle. We're going to make sure we put it in the description box. Hope you enjoyed this. Hope you learned something from this. And until next time, take care.